Let me tell you what they do not teach you in nursing school or medical school. And I feel like if we could understand this, we really could help people's health so much more. I'm Tiffany. I'm a nurse. I own a mobile infusion company. Also, if you're wondering what's going on with my face, I had microneedling yesterday, so it just looks a little bit intense, but it's okay. Everything's good. So, what do they not teach you in nursing school and medical school? I'm an RN. My husband's a physician, so he's gone through medical school. They do not teach either one of them how to heal people. And not really heal, it's really how to make them healthy. You are taught so much, it is drilled into you, the different processes of all the body and what the symptoms look like and how it is treated. So for us in nursing school, we're taught to learn how the different disease processes work and then how we treat them via medications or certain other therapies. In medical school, obviously, they're taught how to treat it as well. I say this because that is the whole basis of what infusions are made for. And my eyes have really been open since leaving the hospital setting. And we own obviously an infusion business. So we've been open a year, which I know we still have a lot to learn, but in that year, we have really seen so much in ourselves and our patients, how addressing things at the cellular level can really improve them. How we address our infusions is we really are looking at the cellular level. Now, remember back in school, the cells are the most basic parts of us. They're the building blocks. And then we have tissues, and then we have organs, and then that makes up, our body. At the cellular level, if we start to have damage or inflammation, then if it's not addressed over a long time, that can start to cause physical symptoms. And then these physical symptoms, if they're not addressed over, everyone's different, it can be months, years, whatever it may be, that is what can lead to disease processes. Obviously, it's a little bit more in depth from that, but the whole reason I'm making this video, it was very eye-opening yesterday. I had a little bit back and forth on social media, and it really opened my eyes to how much we are just taught to treat and help people one way and we're not taught how to help them stay healthy. We're just taught how to get them to a spot where they can manage, and they're either plateauing or they're just going to be on medication the rest of their life. So, what am I talking about? I was posting yesterday. It was something about IV fluids, and somebody commented on it, and they said, well, IV infusions are just expensive urine. I hear that all the time. I used to argue with everybody, or not really argue, just try to educate, but then you just learn there's only so many people that you can help. Some people are just set in their ways because they've been taught that way, which is fine. Infusions aren't for everybody. If you want to stay in that mindset, that's okay. I'm not forcing you. But I replied and I said, what about IV antibiotics? And he said, well, nothing in there said anything about IV antibiotics. And I said, I understand, but how do you think? Do you think they work? And then he proceeded to say how if you're just giving infusions or you're giving mag or whatever's in it to not treat something and you're just giving it to give it, then it can cause additional problems. And I said, well, we are treating something, and it's something that's not taught in nursing school or medical school, and I can attest to this, and then my husband can attest to this. It is more like a functional medicine program. And so I told him a lot of what we treat is oxidative stress. So what oxidative stress is obviously the American lifestyle is very toxin heavy, and I'm sure you hear toxins all the time. Toxin this, toxin that. What are these toxins? So toxins are free radicals, and these can damage our cells. We have the role of antioxidants in our body is to remove these toxins. And so I'm sure the most common one you think about is vitamin C. We have other ones. There's a ton of antioxidants in our body, and they all kind of function for different reasons. So one of the main ones, there's debate on this, but I agree, is glutathione. Glutathione is a peptide that our liver makes, and its whole role is to scavenge these free radicals up and disperse of them. If they're fat soluble, you're going to get rid of them in your stool. If they're water soluble, you're going to get rid of them in your urine. So how do we accumulate these toxins or free radicals? Well, the normal American lifestyle is very toxin heavy, as in if we are not sleeping enough, if we are undergoing stress, whether it's physical stress or exercising too much, or we are just stressed because of our job. A lot of the foods, diet is a huge one. If you have any comorbidities, anything that is really putting stress on the body it creates these free radicals that our body has to get rid of. When we do not have enough antioxidants to remove these, and you can kind of say like, here's our free radical amount in our body and here's our antioxidant level, that's whenever you can have symptoms that are like fatigue. You are constantly getting sick, brain fog. They might be things that you could go to the doctor for, and they check your labs and like, well, everything's okay. Yes, because we're checking the very superficial things that are going to be like your CRP, your, CBC, CMP. All of these are like basic things. These are diagnostic things for kind of like sometimes bigger problems, I guess you could say. And a lot of the cellular stuff are there, unfortunately, very specialized tests that are obviously, because they're going to be preventative type thing, they fall under the preventative. They're not going to be covered by insurance. So they can be like literally hundreds of dollars, and they can take like at least like 3 or 4 weeks to come back. They do not make it easy in order to test these, but you can also go based off how you feel. So if these are things that you're having, well, then we need to raise the antioxidant levels in our body so it can remove these. But also, we need to look at your lifestyle to see, okay, where is this toxin burden coming from? If, for instance, say like diet's a big problem for you, okay, I understand it's not realistic for you to go from eating really bad to just perfect. So let's do baby steps. And, that might look like, let's try to eat, I don't know, I'm trying, 20% processed foods in your diet versus 80%. And, it could be sleep. Let's try to do things that are going to help us sleep better, whatever it may be. So that is how infusions are help. And that is how we treat oxidative stress. You are infusing with, it has to be a specific dosing. If you do low dosing, it's not going to help. And it's, this right dosing and frequency. But by doing this, you're able to give the body all of the nutrients that it needs, or really antioxidants, in order to kind of catch up on this detoxing process. So this is really detoxing. There's different forms of detoxing, but I'm talking about cellular detoxing that is in the infusions. And so you could be like, okay, well, why don't you just replace this one thing and that's all you need? Well, that's where you have to kind of look at the science behind it, because a lot of the different cycles that our cells go through, and also the things that we're giving, like glutathione. So for instance, glutathione, it goes through 2 different phases. It has an oxidized and reduced phase. And all that really means is it is picking up a toxin, so it's either full or it's empty and ready to go get more. If it does not have the cofactors that it needs, then it cannot go through this process. And if you just have glutathione essentially floating around that can't do its job, then what good is that? So that is where infusions on the wellness side. So these are going to be your infusions that you're doing monthly and sometimes more frequently, depending on your lifestyle and all these different factors. But that is what a lot of infusions help with. And of course, infusions are not the only thing. There are a big help, because people can be like, well, why don't you just take oral glutathione? Well, oral glutathione, if you don't take it the right way, it's very sensitive to light and heat, and so it will break down. So glutathione, if you're taking it, so anything that you take orally, as like an oral supplement or a pill, it's only about 10 to 40% that you're going to absorb at that cellular level, which is where we need it, which is great. It's better than nothing, but that's why we want to do oral along with IV route, because you want them to work hand in hand. With IV, you can like very quickly and effectively increase these levels, and then you want to maintain them. You don't just want your body to burn right through them. And that's why if these infusion companies are not also educating on lifestyle stuff, you're just giving them all the antioxidants and the fuel that they need to start the detox process. But say, it's starting to balance out. This is our, antioxidants is coming up. But if they're not changing anything in their lifestyle, this is just going to go right back up, and then they're going to feel the same way. When we have at the cellular level, when you have these free radicals are damaging the cells for a long period of time, that causes them to dysfunction. So think about, this is just a way to think about it. If you are I'm just making something up. Say you have a cell that is no longer able to secrete a hormone like it's supposed to. Well, long term, if it's not secreting that, then that's going to cause other problems that can lead to certain, diseases potentially. It depends what it is. And so by restoring this cellular, removing the toxins and then being able to repair them, and also, being mindful about what you eat, your sleeping, your stress level, all these things are so important. And I can tell you, my mom used to tell me all this stuff and I would roll my eyes. I'm like, yeah, okay, I'm sure it doesn't make that much of a difference. Let me tell you it does. Coming from someone who in my mid 20s, I was so tired all the time that I was very desperate to try anything, and infusions kind of came about. And after, it normally takes someone about like 3-ish months to start feeling, like, oh, I can actually feel this in my daily life. Some people are more quicker, some people will take a little bit longer. That's why you really have to look at the health history, and that is why it is so important to have a provider who consults and who is also able to look over this as well. So that is kind of like very basic level of what IV infusions are capable of. There's a lot of clinics out there who do not offer it like this, and I feel like sometimes it kind of gives a bad rap to infusion companies because it's like, oh, you're just giving an infusion to go on a plane or to help you feel better. Although, yes, this can help, but if you don't understand the science and what you're actually treating and know what to look for in the right type of patients, because I can tell you there are some patients, even though this is how it works, they just live such an unhealthy lifestyle and they have zero want to change, that they may come to you and be like, hey, can I get an infusion? And they might be upset after 3 months because they don't think that they're feeling any better. But actually, this is definitely helping, but they're also still increasing that toxin load that they're not feeling. It's not reversing, I guess you could say, enough to where they're actually able to feel the effects of it. So infusions can really speed up the process of things. And this is just the detox phase. There's a whole nother repair phase. It's what I like to teach on more of the wellness side. And so when our cells are able to work like they should, you can also add things like red light therapy, medically grade red light therapy. There's different types, just like there's different types of infusions, cold plunge, saunas. All these things are so good for your cellular health and really can make such a big difference in how you feel day in and day out, but also will help you age better. This can be like your physical appearance. This can be how you feel. Like, I'm 30 now and I know that's not old, but I can tell you I feel different from whenever I was like 20, and that was only 10 years. But since I have started implementing some of these things, like, I truly do feel better throughout my day, and I do not have to drink as much caffeine. I still drink, it's like 95 milligrams of natural caffeine in the morning just because I like it before I run, but it really can play such a big role in your life as well as your patient's life as well, and I have seen it. So that is my little 2 cents on infusions and what you probably don't know about it. And they don't teach it in nursing school or med school because they teach you how to treat the disease or these symptoms, not like, tell me when you've ever gone to a doctor. And I'm not saying this doesn't happen, because there's definitely some doctors are very mindful of this. But tell me the last time you went to a doctor and you were given a medication and there was any plan to get you off of it. I know I had some gut issues a couple of years ago, and this is really the first thing that I've had to take like a prescription medication for, other than like, you're sick and you have to take an antibiotic because you have some sort of bacterial infection. But I remember I went to the doctor because I was having like a lot of constipation issues, which was really weird because I was like an overall healthy person and I didn't change anything. And he was just like, here, we're going to take this medicine. And I was like, so do we know what's causing this? And it was just like the broad, like, oh no, you just have IBS-C, which I understand he's doing his job, but like, I want to know why. Like, this just didn't come out of anywhere. And long story short, I went on a medication. It destroyed my gut. Let me tell you, it has been like a process to fix things because it was kind of like a stimulant for your gut, which of course then you stop taking it and RIP, like nothing wants to work. But I ended up going to a naturopathic doctor and she put me on all these like vitamins and herbs and whatnot. And honestly, this is before I'd gotten into infusions. I literally was thinking, this is not going to work. How can, what she's telling me to do, like drink warm water, this, take this at this time and this time. How is this actually going to help? But I was so desperate. I was like, okay, fine, we'll try it. Guess what? It worked. I was like mind blown. So then I was like, okay, well, what else can we do that's natural? And I already had energy issues. So that's kind of when we kind of dug into all of this. And it's one thing to be told something, but then to look at like the science behind it, like, okay, how does this cycle work? Oh, this needs this part of vitamin C, or this works like this. So if we replace this and this takes away from it, you can feel better because it's needed for that process. And that's really what you're doing with infusions. And so they literally can be life-changing for people. Of course, it has to be people who have like the want to be healthy and to improve their lives. You can't just give infusions to someone who is expecting infusions to be a cure-all, fix-all, because although it will help them, they might not see it because they're still putting all this junk in their body that is, you're just undoing what you're doing, essentially. So that is my little 2 cents for today. This is my channel where I go over all things mobile IV therapy startup and education.